Hello, I'm Dr. Lonnie Herman. I'm with a patient of mine, Mr. Peter Yanikuros. He comes down to my clinic in South Florida from, you're in upstate Florida, and also it was South Carolina, right? And your condition that you came here for, we've got several symptoms that you started here for, but one of them was you had the terrible rash on your face.
Yeah, dermatitis, seborrheic dermatitis.
And how long did you have that rash?
Since I was 16 years old.
So you were going on 10 or so years with that rash on the face. And did it ever get worse or better with anything you did?
It would probably get worse. It would fluctuate, but it would always be there no matter what. Red spots on my face, dry skin, dry flaky skin. And a dermatologist told me there's nothing I can do, just take this cream for the rest of your life.
And did the cream ever give you relief?
It did, but I mean the condition would just come back. It's something I'd have to do day by day. And the cream wasn't exactly natural. It had steroids in it and all this stuff.
And so, but the rash was across the cheeks and the nose.
Exactly,
right?
and sometimes the forehead, side of my face, bottom of my face.
You had joint pain as well?
Yeah, I had infrequent joint pain, but yeah, it was there.
How severe was that joint pain? If 10 is the worst and 0 is no pain, how would you rate that kind of joint pain you suffered?
Probably 3 out of 10.
3 out of 10?
Yeah.
One of your main conditions you came for was because of a heart condition.
Mm-hmm. Yeah, that was the main reason I came.
And can you describe it for anybody?
Well, my heart would basically pound 24/7, like beat out of my chest for absolutely no reason, and I'd have really bad chest pain and pretty bad shortness of breath, and just Googling it, it seemed like I was having a heart attack, but it was like that almost 24/7, and yeah, it was really bad. Yeah, that was basically the heart symptoms.
That was a symptom. How many different cardiologists or hospitals or ER visits did you go to? Did you go to ER for this heart condition?
Yeah, at least.
Terrible. I mean, it was a palpitation that was like it was coming out of your chest, your heart.
Exactly.
Is that how you described it?
Yeah, and the pain.
And the pain, was it a pain like a gripping, like somebody squeezing the heart?
Squeezing
the chest?
It was mostly stabbing pains, sharp stabbing pains.
And that was also 24/7, or that came and went, that stabbing pain?
Came and went, but throughout the day.
And the breathing difficulty you had as well?
Yeah, shortness of breath, almost never being able to take a full breath, feeling like I'm wheezing sometimes.
Did they ever diagnose it as asthma?
No, I took many breath tests, everything came out normal.
And EKGs of the heart, did they ever show any problem?
No. Oh, yeah, absolutely no problem. EKGs, echocardiograms, stress test, chest CT scan, all that stuff.
You had the heart monitor that you wore for days?
I wore a 30-day monitor.
30 days.
Nothing showed up.
Nothing showed up.
Yeah.
What did the cardiologists tell you who had examined you from different facilities? What did they tell you? When they couldn't find anything, what did they suggest?
Well, because I saw quite a few, they all had different things to say, but more or less the same thing. It's all in your head. It's anxiety. One person told me, oh, you have acid reflux.
And did you ever take acid reflux meds for that?
Yeah, I took acid reflux meds, and
did it help?
Absolutely not.
Did the anxiety meds, did they prescribe you Xanax or something like that?
Yeah, I was prescribed Xanax at least 3 times, and I took it once. I didn't feel any better, so I knew it wasn't doing any good. I just stopped taking it, and because I knew it wasn't good for me and it wasn't going to help my condition.
Did you also, how long was the chest pain going on for?
For about since April 2015.
Okay, and how long was the heart palpitation, that severe heart palpitation, 24/7 heart palpitation, how long was that going on for?
Same. It all started in April 2015.
Okay.
Yeah.
And there was no one trigger that you could remember?
No. I mean, I suspected it was environmental illness from mold or something like that.
That's what you thought?
Yeah. That's what I assumed.
And you also had a brain fog, or a kind of a cognition troubles?
Yeah, I've always had trouble since as far back as I can remember. I've had trouble concentrating and focusing and just having a clear head and just thinking in general. I've always had trouble articulating my thoughts.
And would you go back as far, when you say as far back as you can recall, is that going back to even grade school? When you were a kid, as far back as you can remember?
I would say, yeah.
Okay, and since we've been working together doing this type of care that I offer, and removing the agents that we found in this kind of work that we do, your heart palpitations now, how bad or how good? What changes have you experienced with these heart palpitations at this point? And he's been under my care for, it's about a year now. And a lot better now than it was when I first met you. I must say that there's been a lot of advances that you've even noticed with this work that I offer. But what is your heart palpitation level now compared to what it was?
It's probably 50 to 60% better.
And we think that there's going to be even more dramatic after this protocol, which hopefully we'll do another video to even see when it's 100% to tell everybody.
Yeah.
50, 60% better, and that's without any drugs, without any meds.
Mm-hmm.
Did you have any relief of the breathing condition, the shortness of breath?
Oh yeah, I've had pretty significant improvement with
Can
that.
you give a percentage wise?
Probably around 50%.
Okay, and do you ever get short of breath now?
Yeah, I get short of breath occasionally, but it's never like an emergency like it was before at the peak of my illness.
There's no reason for ER visits for this at all?
No, I know it's something that'll pass, and
Now you're
it's good. I
comfortable.
can function normally
Yeah.
with it. Yeah.
The chest pain, is that still there?
Yeah, it's still there.
How much improvement is that?
60 to 70% better.
You're happy about this so far, these
Y-
improvements?
Yeah,
Dramatic.
extremely happy.
When you brought up earlier when you came in today about the cognition, the brain fog, or the thought, or the ability for you to, have clear brain, how is that now? I don't want to put words in your mouth now, what you said earlier when you came in.
Well, it's a complete 180. I feel like I can focus and concentrate a lot better. I'm back to living a normal life. I'm back in school, and I can focus just fine. And yeah, it's great. I've never been able to think more clearly than I'm thinking right now, and I'm even better mentally. I'm even better than I was than when I was healthy. I mean, when I was healthy.
When you thought you were healthy.
Yeah, I thought I was healthy, but no.
Mhm.
Right now, like mentally, I feel very good.
And the joint pain is gone?
Yeah, joint pain is
And-
nil right
and
now.
the facial rash that we could see, it looks like it's gone. You're not putting any treatments, no lotions, no creams on there.
No.
And what we're doing is cleaning out the infections and the toxins that I'm finding in specific tissues of the brain and the bone marrow, and I'll get into his protocols in another video, but I do appreciate you coming in and being able to share this improvement so far. And when we have the next improvement, which I believe that we're going to get 100% relief, total 100% relief of any heart palpitations in his heart, and that experience will be gone, as well as the shortness of breath will be 100% gone. So it's going to be not even infrequent, it's going to be gone, as well as any kind of chest pain will be 100% gone. So it's going to be 100% recovery for you, and you know that.
Yeah, now I know.
And now we'll get to the point where we can make another brief video with your approval, that we can make another brief video that will show that this is an intermediate video, and we'll have the later on video that's going to show even more dramatic improvement. But I appreciate you sharing this with us.
No problem.
Okay. Anybody who wants to make an appointment, we'll put the number on the bottom of the screen and the email, and you can contact our clinic. Thank you for watching.